Communities are caught in a lot of difficult circumstances right now, where there are a lot of powerful entities that aren't really holding access as a central tenet. And so that's where a lot of advocates are focused right now. Amongst pharmaceutical companies, obviously the price of their products, make it incredibly difficult to distribute and get out throughout into the community. They'll usually point to patient assistance programs as being a way of getting around that. But the fact of the matter is that when you're trying to get something that's the price of a car out into the system treats it like something is as expensive as a car. It's harder to get to, it's harder to get coverage. And ultimately, for communities that are marginalized, it means that there are a lot of hurdles for them to gain access to that. We're seeing a lot of threats at the federal level right now. We've never seen the access programs that we would like to see for un- and underinsured populations. We've been pressing for a national PrEP program actually since 2018 and saw some traction on that. But right now we're starting to see a pivot toward actually trying to cut critical federal HIV prevention funding, which is a real shame given that we have so many great options right now. We're also seeing some real threats for insured populations around PrEP access. Just yesterday, actually, we heard that RFK Jr. canceled a scheduled meeting of the U.S. Preventive Services Task Force, which oversees guidelines for preventive services that any insurers that have to be compliant with the ACA have to provide without cost sharing if they have an A or B rating. PrEP is one of those things. So we're all very worried right now about how all of this plays together, how all of this is going to undermine PrEP access. We're worried on the treatment side as well right now. We've had some greater successes for people living with HIV historically being able to access through the Ryan White HIV/AIDS program. But right now, just this week, we saw advocates raising the alarm that they're concerned that upcoming negotiations with Gilead and Merck in particular to provide price points for those products are not going smoothly enough. And we're worried about wait lists coming up for people living with HIV again as well. So a lot for advocates to be paying attention to right now, and a lot for all stakeholders in the system to pay attention to.